From the Netherlands back to Nairobi, Kenya, the Ministry of Health, in collaboration with Amref Health Africa, have launched a fleet of mobile vaccination clinics in an effort to increase vaccine access and uptake in the country. Health Principal Secretary Susan Mochache noted that the movable clinics will take COVID-19 vaccines and other services to communities with no access. The initiative comes at a time when the country is facing an increase of cases in COVID-19 infection. Jacqueline Masharia with that report.
Mobile clinics fully equipped and designed to operate efficiently are set to enable vaccination of 70 to 100 people per day each and reaching up to 1,000 people per day once all 10 mobile clinics are fully operational.
This movable unit, because of the need for it to go further and further from the grid of the facilities, it is actually powered by solar. So it is fully power solared. So the electricity inside is power. Everything we do, the lighting, the cooling, the refrigeration, is power, is solar power, which means that it can be left anywhere and will be operational for as long as we want, and then you can move it to another area. It is sustainable, it is durable, it is going to serve communities and ensure that communities are safe so that we can protect lives and livelihoods.
According to the Ministry of Health, 50% of residents in Nairobi have been fully vaccinated against COVID-19, while 20% have not received any vaccine. Health Principal Secretary Susan Mochache, however, noted the government is targeting to vaccinate adults by December this year and 50% of teenagers by the end of the year.
I want to take this opportunity to reiterate the importance of vaccines, and we will not tire as a Ministry of Health and as a government to reiterate that it is important for us to be vaccinated in order to prevent the development of severe COVID-19 disease and its associated deaths. Vaccination remains the most important strategy for preventing severe illness and death where COVID-19 is concerned.
On other health determinants, such as non-communicable diseases that influence how health emergencies affect the country, Dr. Githinji Gitahi, Group Chief Executive Officer, Amref Health Africa, said it was critical to avert the negative impact that health emergencies such as COVID-19 have on communities.
Countries and communities that are vaccinated have reduced their risk of severe disease, have reduced their risk of death, and therefore they're able to go on with their lives. This is really what we aim. This is what we aim for Africa. This is what we aim for Kenya specifically.
These non-communicable diseases certainly have a crippling economic impact on our country. People who are living with cancer, diabetes, high blood pressure, amongst others, are the ones who are at most risk of developing severe COVID-19 as a disease.
This as 232 people tested positive for the disease from a sample size of 2,030 tested in the last 24 hours. The positivity rate is now at 11.4%. According to statistics from the Ministry of Health, 390 patients have recovered, pushing the total recoveries to over 322,000. No death was reported in the last 1 day, and cumulative fatalities remained 5,652. The government maintains that the COVID-19 vaccine remains the most effective arsenal against the disease. The Ministry of Health now hopes that by taking the campaign to each doorstep, more Kenyans will be encouraged to get the jab. Jacqueline Masharia for Prime Edition.